Welcome back at 7:16. January is Cervical Cancer Awareness Month. Each year, more than 13,000 women are diagnosed with cervical cancer in the United States. Yet cervical cancer is one of the most preventable cancers today. In most cases, it can be prevented through early detection and screenings. With us this morning is Touro OB/GYN Dr. Vibha Rao to discuss cervical health and cancer prevention steps. Good morning, Dr. Rao. We appreciate you being with us. So let's first talk about cervical cancer. What is that? I know we hear all kinds of different cancers, but what is this one specifically? Obviously impacting.
So cervical cancer, so the cervix is the opening to the womb. It's what you see when you do a pelvic exam all the way at the end of the vagina. So cervical cancer is cancer of that part of your uterus.
And we were talking about how screenings and early detection are so important. Talk about a screening. Is it something that happens every single year, or is it something that you should do at certain times depending on your age, as with other cancers?
Yeah, absolutely. So there's different guidelines as to when to really start cervical cancer screening. I think when we were growing up in our parents' generation, they would screen as soon as you came to see your gynecologist. But now we know, based on how slow growing it is, that you can, and based on how most of the cervical cancers develop, you can actually screen at regular intervals. You start at the age of 21, do it every 3 years up until the age of 29, and then every 3 to 5 years, depending on how you're testing for cervical cancer.
And so this is outside of a regular pap smear that you would get, and pap smears aren't even annual anymore, right? I just learned that in the last year. But so that they're outside of the annual checkup, I guess, with your OB/GYN.
So they actually occur at your annual check. Okay. So that's the easiest way for us to get a hold of people. So we'll screen you, and then it's really great if you follow with the same OB/GYN or at least have records on hand. So we know at what regular intervals we need to screen you specifically. But they are individualized to whether or not you've had any abnormalities before of the cervix, or if we're following something more closely.
And if something is abnormal at the during the pap smear, when the cultures come back, what are the next steps?
Yeah, so there's different, so once we've screened you with the pap smear, it comes back abnormal, then we can move forward and do things like a colposcopy, which is where we take biopsies and take a closer look with a special microscope. And then if that then comes back abnormal, we can do excisional procedures or shave off or take off parts of the cervix that are abnormal.
So we have about a minute left, Dr. Rao. Let's talk about prevention. We were talking about the HPV vaccine that's been around for quite some time now, but things have changed with it a little bit as far as dosing is concerned, right?
Yes. So we can start giving people the HPV vaccine as early as 8 years old.
And that's boys and girls?
Boys and girls, because both individuals can be affected.
Okay.
It can start as early as 8 years old, but generally we recommend around 11 to 12 with your pediatrician, based on a shared decision-making between the parent and the child and the doctor. It's a really easy preventative way to prevent contracting human papillomavirus, which is what causes most cervical cancers these days. It can be a 1 to 2 dose or 3 dose vaccine. And if you get it before the age of 15, you actually don't have to get all the doses. We find that it's just as effective. And then after 15, you get the full series.
I'll have 1,000 more questions, but unfortunately we run out of time. But we appreciate your time this morning, Dr. Rao. Thanks so much.
Thank you.